Hi, my name's Kevin Bell. I'm the CTO for the Innovation Centre at Alder Children's Hospital. And I'm going to talk about our intelligent automation journey that we've had here at the Innovation Centre. So just start off, some of the areas I'm going to cover are just around introduce the Alder Innovation Centre, know what that's about, talk about the journey, talk about what impacts we've had on a few use cases, and then about what's next for us. So at Alder we do have a really great, lively and productive innovation centre. It's an incubator. We solve real world problems, and we've got 4 labs that sit within a 1,000 metres squared hub space, which is great. And we bring in SMEs and everything, as well as academic and industry partners. We have an open innovation process. We do have look around commercials and so on as well for spinning out products, licenses, and VC investments and so on. And one of the other streams that we have within the centre is about nurturing innovators for the future. So that could be one of the admin staff in the hospital to one of our clinical entrepreneurs, for instance. So as part of the Innovation Centre, we have AIHQ. So that's our team that essentially do all our automation, AI, etc. They're really great bunch of people that do problem solvers, work with people across the trust and outside the trust to co-produce solutions. We're constantly looking at growing the team and how we can create jobs for the local economy and across the NHS, and help the SMEs grow as well. We also have a bespoke service provision, and that's our hyper automation is what we look at. So what do I mean by hyper automation? Well, we have what we call our toolkit. So that means that we can develop robotic process automation solutions using bots, and we can develop our apps, digital platforms, digital therapeutics, and AI solutions. Underpinning all of that, we use cloud and big data approaches, and we actually end up being able to create, sometimes using all of these things to create the right solution for everybody. So some of our achievements to date, proud to be able to talk about, which is, we've got 5+ AI models actually deployed out in the hospital that are being used every day. So that's been a really fantastic achievement. We've got over 20 apps that are being used to support nursing communities, support internal staff and particular projects. We've got digital therapeutic platform, which is the CYP as one mental health platform. And that's allowed us actually to allow people to self-refer into services and so on. So it's really good. And we've got more platforms on the way as well. We've got 4 departments using robotic process automation at the moment: booking, scheduling, HR, CAMS, and validation team. Which has been fantastic. And the impact that we've actually had to date, we've done over 3,500 hours time saved, improved over 1,500 patient records, and be able to reduce the admin burden for staff, clinicians and admin across the trust, and improve things for patients as well. So automate for impact is our slogan. Everything we do, we look to make sure we really do have impact. Some of the things that drive us, we've also seen the headlines around NHS waiting times is ever growing lists and backlogs with COVID, and the general problem we have with people need the demand on healthcare, and there's things around clinician burden and admin burden within hospitals. So there's a number of things that drive us, and obviously any of these things also have impact on patient experience, which is one of the things we want to make sure we do improve. So we have lots of processes around that we go through when we do automations. Our general principles are, when we look at a project, is, are we going to save time? And more importantly, are we going to make things better for people? If we can answer both of those, then hopefully it will go ahead with the project and we end up with a happier workforce and happier patients. Some of the benefits of that will be around increasing capacity, increasing the quality of the services and processes, reducing burden, like I've talked about, avoiding future costs. And sometimes we do save money, but that's not a predominant thing that we aim at. So our automation journey started back in July 2020. So we quite quickly during COVID understood that actually we had a lot of processes that required manual intervention. So we went on a journey of actually talking to the organization as a whole and various departments, up to execs, and trying to engage people to say that this is something we should be doing, in implementing robotic process automation. So we went through a little period of time doing that, but it was great once everybody was really on board and really supportive. So we went ahead and agreed with the vendor to do that. We went through the technical setup, and shortly after that appointed the actual head of RPA for the service. So we kind of had the right foundations ready in place. Program started to develop already. There's lots of ideas across finance, HR, and the clinicians were getting involved in everything. So it was really, really positive. When we first started, we decided that our first automation should actually be a challenging automation. So we wanted to pick something that was complex, but had lots of benefit to it, lots of hours to be saved, and would really help the team. So we picked on one process around the booking scheduling team that had a really high demand for processing referrals through the system. Took us about 3 months to get the first thing written, and about another 3 months to actually get it fully tested and working and live and running by itself. But it was the good thing about doing it that way was we could actually find a lot of learnings, and we had and also a lot of objects that we could build and use again and again for other automations going forward. So it was really worthwhile doing. Following that, because we did actually work with Blue Prism, our vendor, at the time, to go through that process, we outsourced it essentially. And whilst we were doing that, we were also looking for our first RPA developer to join the team on a permanent basis. So that happened shortly after that automation was complete. And then they were able to take that on, and they have reused all those objects now and learned lots from that first initial automation. So after we got the RPA developer in, we then did the first RPA analyst, and then our trainee, and now we're on the growing the team. So it's really, things are really expanding, and it's going to keep going. So the project I was talking about, our first automation, was for the booking and scheduling team. That process alone does 200+ hours per month of savings. We can maintain service levels now at two days turnaround, reduce risk of delays as well in the triage of those routine referrals. So following that success, we then went on to deal with appointment slot issues and audiology referrals. So being able to help that team out hugely, and there's a lot more to do to help them. Our second big project involved automation, was the human resources app. So we took all the paper processes and developed a Power App for that. So the trust staff, managers, etc., could go on and fill out the forms that they needed to for each of the HR processes. And then on top of that, we then process those automatically through our PA to make sure they go straight onto the ESR system once they've been approved. So the big ones that we did initially were around staff contracted hours and staff leavers. And that meant that we saved around 20 hours a month, which is a lot for a small team that they are. And we had to take the process down from 30 to 10 minutes. It also reduced the number of payroll errors as well, and staff experiences improved. So there's a more standardized turnaround time for these changes that are requested. One of the other things we've done, which has been really important actually, is the mental health platform that was launched last year. As part of that platform, people can self-refer. So you've got actual children self-referring through that platform. What we've done with automation on that is actually take those referrals that are going through the platform and to get them straight onto our electronic patient record. So they can be triaged really quickly, and then in some cases like the eating disorders pathway, we've been able to actually automate it right through to booking an appointment, so there's no delay for the patient. We've been able to improve efficiency. It's saved over 50 hours every month of manual entry, and the experience for the patients and families in booking those appointments is improved drastically as well. So with all this, we're hoping to scale that further out into the ICS and beyond as well. One of the other sort of use cases we've had for automation has been around more helping projects, supporting projects, so one-off types of work. So one of the projects that were going on was around data quality. So the validation team had a high number of fixes that they needed to do, that they identified on the records, and demographics and discharging patients and cleaning up the wait lists. So what we did after a bit of consultation with them, we were able to build the process that they needed within less than 5 days. In part, that was to do with the fact that we've taken that more challenging process in the first place, our first automation, which gave us most of the objects to do that. So we saw a real big efficiency there. We impacted about 1,500 patient records, and we actually avoided the team having to do 140 days worth of work through 5 days of investment. So it was well worth it, great return on investment, and helped the team tremendously. And we're doing more and more of that now, and those big high volume activities. So artificial intelligence, we've been on a very similar journey with that. It's probably about a year ahead of our automation RPA journey. And like I said earlier, that we've got about 5 key projects that have been deployed out into the hospital, which has been great. But there's one where last summer we had an opportunity to actually do something quite different. So I thought I'd talk about that. We were able to be part of a collaboration with 10 other children's hospitals. And we put forward some ideas, and the one that actually all the hospitals accepted as part of the program was our Was Not Brought AI predictor tool. So that essentially predicts whether somebody is going to attend an appointment or not, or what the likelihood is of that. So the reason we tackled it in the first place was because we know there's a high rate of children and young people not being brought to the appointments for a whole variety of reasons. But what we want to do is a more targeted way of being able to look at the patients that are unlikely to come and see if we could do something to help them. The model was developed and we got over 80% accuracy, which is really good. And as part of that, we've been able to do a number of preemptive interventions, reallocate those slots that were being used or going to be used, and reduce waiting times and lists, etc. So that's been really good. The other benefits of that has been be able to reduce health inequalities through providing more equitable access to care. And one of the other big things that drives us in the AIHQ team is developing things that are repeatable models and are scalable. And this was a really good example of us actually being able to develop something once. We did have to do more to make it scalable, but not much more. And we actually have that now running in 10 children's hospitals across the UK. And our next stage for that is to turn that into a product that can be done wider than those hospitals. So the next 12 months, what does this look like for us? It's going to be busy. We've got planned savings of 1,200 days through observation, so 9,000 hours. That's going to be across 20 new processes from 10 departments. So it's going to be a lot of work, and that will involve the whole team. So we'll be developing apps to support that. For AI, we've got some natural language processing elements to that as well. And that will all tie together with the robotic process automation to actually deal with the data entry and so on. So we've got a big challenge there. Alongside that, we're also growing the team to support the Cheshire and Merseyside region in a cooperative model approach. So that will mean that we can help support them getting set up, getting the right skills in place, help them develop processes, but working as a region to make sure we're sharing and be able to sort of disseminate that knowledge down across the region. Hopefully, once we've got a long way into that, we'll then move to a wider model. So thank you for listening. If you need to or want to get into touch, discuss anything further, my email address is there. Thank you.